Turning now to medical news, pioneering surgery using 3D printing enabled doctors to reconstruct the fractured skull and face of a man injured in a motorcycle accident. The patient, Stephen Power, talked about his life before surgery.
My confidence at the time before the accident, before the operation, was low because obviously I knew what my face looked like. I was obviously trying to hide it away. I didn't want to go out as much. I didn't want to be seen, because I know my face wasn't right, and obviously other people could see my face wasn't right, so I wouldn't go out as much, or I'd only go out if I had to, whereas now I can go out when I want to, basically.
Dr. Elliot Duboys is a plastic surgeon and associate professor of surgery at Stony Brook University Medical Center, and he joins us here in our New York studios. Welcome to Arise America, Dr. Duboys. Thanks for coming in. You did not work on the surgical team that fixed the face of this gentleman, of Stephen, but you've used the 3D technology recently on a little baby, Gabriel. So first of all, tell me how you use the technology and how it helped you in solving his medical issues.
Well, the two cases are a little bit different because we use it for surgical planning techniques. In the past, we would basically wing it, I guess to put it lightly, that we would cut on the fly and plan our surgery as we were going. This way, using this technique, we were able to go ahead and make a model of Gabriel's skull, send it over, and through a web conference, we were able to actually do the surgery on the models. So it was more model surgery, whereas the other individual had portions of his bone reconstructed using 3D printing.
Yeah, well, they actually grafted in those 3D printed devices. But can you sort of explain how this technology works, what's really happening here?
Sure. They basically take the CAT scan, which is available at just about any hospital, and they send it to a manufacturer. We happen to use an organization out of Colorado, and they will then in turn try to fabricate the missing pieces. And they're able to do that out of methyl methacrylate, which is a commonly implanted material. And then they send that back over to the surgeon, who then implants a perfect replica of what exactly is missing.
And I do remember that you said that the way you used it with baby Gabriel is a little bit different than the implants that were created for Stephen Power. However, what will you be able to do using this technology that was not available to you or not as easily available to you before it?
It's actually been around for a number of years. They took it from the manufacturing industry, what used to be called CAD/CAM, computer-assisted design, computer-assisted manufacture, and now brought it over to the medical sector. So probably about 10 years ago, we used this for a depressed skull fracture. It was an individual that was in a motorcycle accident, but it really wasn't his face, it was more his skull. So in the past, we would go ahead and make a prosthesis for him, an implantable prosthesis, in the operating room. This way, we're able to plan the prosthesis, and with surgery that would usually take an hour and a half to 2 hours to do, took us basically 35 or 40 minutes to do. So it really cut down dramatically.
And explain why that's important, why being in the operating room a shorter amount of time is really key and essential.
Sure. Complications are directly proportional to amount of time in the operating room. So if you can cut back on the amount of time in the operating room, you cut back on complications.
Well, and can you sort of give me an idea of the range of applications for this technology?
Well, I'm much more familiar with the techniques in plastic surgery, but they are using it in oral maxillofacial surgery. They're using it in orthopedics right now, in neurosurgery as well as in plastic surgery.
Are there any inherent limitations to using it for you?
I don't know. I'm still a neophyte. This is actually Gabriel was really our first venture into using computer-assisted surgery, but in the planning stages. And we took a relatively simple, straightforward case to begin with, and I think it's going to be very, very important in the future when we have much more complex surgical procedures to do that. We can actually do it on a model rather than on the actual patient.
I understand you're about to use this technology again on a surgery that's coming up. Is it next week?
It's this coming week, yes.
Is it similar to Gabriel's case or something different?
It's almost identical to Gabriel's case. So now the learning curve has gotten much easier to do.
That's nice. Is this in some ways going to, and I don't want to over-dramatize it, but sort of revolutionize what surgeons are able to do or the way they're able to do it?
I think it's going to facilitate what they're able to do. I don't think this is revolutionary as of yet. I think it's much easier to work off or outside of the operating room than in the operating room. It took me longer, actually, to prepare for the surgery, before the surgery, for the first case, but for the second case, it took me probably about 1/3 the time. So I think it's going to facilitate, revolutionize. I want to be a little bit cautious at this point.
I know, and doctors usually are in that regard. That's why I prefaced it. There are basically two types of surgery. There's soft tissue surgery, and then there's hard tissue, the bones, the joints, that kind of thing. Is this, in these two cases are hard tissue?
These are hard tissue.
Is this applicable in soft tissue? So if someone needs their appendix out or a heart transplant or something like that, could this technology be used?
Well, they're using it right now. There's a company in the United States that's doing 3-dimensional printing for organs. It's still early. A lot of people might have seen the ear on the back of a rat a number of years ago, and these are all things that are being done, that are being worked on. It's not FDA approved to the best of my knowledge now, but it's something that's going to be down the road, and I think that will revolutionize care in the future.
How expensive is it?
From what I understand, they gave me a range of anywhere between $5,000 and $10,000, but then you also have to consider what the time in the operating room would cost. So even though it sounds expensive for the company, I'm sure transposing that into the operating room probably would be equivalent.
It sounds really, really cool, Dr. Elliot Duboys. Thank you so much for coming in and
Thank you.
explaining. We do appreciate it.
That was